Good morning, good afternoon, good evening, sir, classmates. This is Crispy John V. Garces, and we are the Group 2 to be present. And the topic was given to us is about sexual self. And there have 8 categories of under the sexual self. And before we proceed to our topic, let's take a look our objectives. For today, we're going to talk about gender and sexuality as we discuss on what we call sexual self. So let's ponder upon a question. What is sexual self? Sexual self is a part of yourself where you learn and understand your sexual development and how people's sexual activity, beliefs, misconception, and unlimited access from the internet on sex can influence your own sexual behavior and response. This lesson aims to discuss the following, but not all of them, and I rate 98.9% that we will discuss it. Charot. Seriously, we talk about sexual behavior, human sexual response, sexual orientation, and in doing so, we're going to adapt what we call psychological and cultural lenses to consider factors from various fields in explaining gender and sexuality. And we won't just present this topic, but rather we're going to consider the what other fields to say about this topic. So let us start. First that I'll begin. I'll talking development of secondary sex characteristic at a human reproductive system is my topic. So today, I'll be discussing about an important on how secondary sex characteristic does develop. Wait a second. Do we know what exactly secondary sex characteristics are? Secondary sexual characteristic. These are characteristics that exclusive to the individual sex of a person and not primary. What does that statement mean, by the way? By the word sex, I mean female and male, and not primary. This is not required of process of reproduction. So that's why we call them secondary. For instances, secondary sexual characteristics are these sexually dimorphic characteristics that are not directly involved in production. Example, some secondary sex characteristics include the facial hair of the human male, the relative prominent breast of the human female, the antlers found only in the male of most species of deer, and the colorful plumage of the males of many species of birds. Are you already know or learn what is secondary sexual characteristic? Then let us understand the concept with another example. So let's ponder this question. What initiates development of secondary sex characteristic in males? Testosterone is responsible for the development of secondary sex characteristic, features that stimulate male development, including characteristics that are not part of the reproductive system, such as facial hair growth and voice changes. And finally, for female, secondary sex characteristics include relative lack of body hair, thicker hair on the head, rounded hips or figure, a decreased ability to generate muscle mass at a fast rate, decreased upper body, breast, ability to nurse children, a menstrual cycle, and increased body fat. Is secondary sex characteristic related to the reproductive system? For instances, in a nutshell, the secondary sexual characteristics are not directly part of the reproductive system. Now we know. Bye.
Hello, my name is John Samson and I'm going to talk about the erogenous zone. So, what is erogenous zone? Erogenous zone refers to parts of the body that are primarily receptive and increase the sexual arousal when touched in a sexual manner. So, this is the part of our body if someone touches in a sexual manner. So, it will increase our sexual arousal. So, what is sexual arousal? Sexual arousal is state of excitement or energy expenditure linked to an emotion. So, some commonly known erogenous zone are the mouth, breast, genitals, and anus. So, erogenous zone may vary from one person to another. So, if your erogenous zone is mouth and you didn't say to others that mouths, so maybe in the other parts of our body. So that is called erogenous zone may variant from one person to another. So other common areas of the body that can be aroused easily may include the neck, thighs, abdomen, and feet. So next is the erogenous on the female parts of the body. So first is clitoris, the body part contributing most to sexual arousal. So, second is vagina. The interior of the vagina, however, does contain nerve endings, and women report that deep stimulation leads to more intense organism. So, next is kanang mouth. A recent survey found that kissing to be more important in a relationship building than sexual arousal. So, that's right. So four is neck. So according to a large international survey, a woman both and nape back to the neck are among the top erogenous zones. So fifth is breast and nipples. So while both men and women mainly like to look at breasts. So they are not just for show, they play a role in a sexual arousal well. So next is the last is ears. Ears are super sensitive to touch, probably due to a large number of nerves endings. Next is erogenous zone on the male body. So first is the penis. The head of the penis, the glans, has about 4,000 nerve endings, which makes it one of the most erogenous zone of the male body. So next is the mouth and lips. Male respond to the light touch, temperature, or pressure. So next is scrotum. Scrotum is the one of the men's most notable erogenous zones. Next is the neck. Neck has great sensitivity to low frequency vibration, make it a prime spot for light's erotic touch. So next is the nipples. Male nipples don't appear to serve any real purpose, but that doesn't mean they're totally useless. So next is perineum. Perineum, which help convey sensation of sexual pressure from the genitals to the brain. So the last is ears, highly sensitive to touch because of the high number sensory receptors on the skin. That's all. Thank you.
Good day everyone. For this video, I am going to tackle about understanding the human sexual response. What is sexual response cycle? Sexual response cycle is the sequence of physical and emotional changes that occur as a person becomes sexually aroused and participate in sexually stimulating activities, including intercourse and masturbation. Knowing how your body responds during each phase of the cycle can enhance your relationship and help you pinpoint the cause of any problems. The sexual response cycle has 4 phases. First, excitement. Second, plateau. Third, orgasm. And the last is resolution. Both men and women experience these phases, although the timing is usually different. For example, it is unlikely that both partners will reach orgasm at the same time. In addition, the intensity of the response and the time spent each phases varies from person to person. So understanding these differences may help partners better understand one another's bodies and response and enhance the sexual experience. I'm going to discuss the 4 phases of sexual response. So we will start in phase 1, which is excitement. Excitement, where muscle tension increases and heart rate quickness and breathing is accelerated. There are general characteristics of excitement phase, which can last from a few minutes to several hours. Include the following. Nipples become hardened or erect. Blood flow to the genitals increases, resulting in swelling of the woman's clitoris and labia minora or inner lips and erection of the man's penis. Vaginal lubrication begins. The woman's breasts become fuller and the vaginal walls begin to swell. Phase 2. Plateau. Plateau is where breathing, heart rate, and blood pressure continue to increase. Muscle spasms may begin in the feet, face, and hands. There are general characteristics of the plateau phase, which extends to brink of orgasm, include the following. The changes begun in phase 1 are intensified. The vagina continues to swell from increased blood flow and the vaginal wall turns a dark purple. The woman's clitoris becomes highly sensitive, may even be painful to touch, and retracts under the clitoral, avoid direct stimulation of penis. The man's testicle tighten. Phase 3. Orgasm. The orgasm is the climax of the sexual response cycle. It is the shortest of the phases and generally lasts only a few seconds. These are the general characteristics of this phase include the following. Involuntary muscle contractions begin. Blood pressure, heart rate, and breathing at their highest rates with a rapid intake of oxygen. Muscles in the feet spasms. There is a sudden forceful release of sexual tension. In women, the muscles of the vagina contract. The uterus also undergoes rhythmic contractions. In men, rhythmic contractions of the muscles at the base of the penis results in the ejaculation of semen. Phase 4. Resolution. During resolution, the body slowly returns to its normal level of functioning and swelled and erect body parts return to their previous size and color. This phase is marked by a general sense of well-being, enhanced intimacy, and often fatigue. Some women are capable of rapid return to the orgasm phase with further sexual stimulation and may experience multiple orgasms. Men need recovery time for after orgasms, called a refractory period, during which they cannot reach orgasms again. The duration of the refractory periods varies among men and usually lengthens with advancing age.
everyone, my name is Danny Amis Jr. In this video, I will discuss the basic biology of sexual behavior. So when we say biology of sexual behavior, as an aspect of human sexuality including the reproductive system, the sexual response cycle and the neurological and hormonal factor that affect this process. The sexual response cycle is a model that describes the physiological responses that take place during sexual activity. So, it means it talks about not only the emotions of sexual behavior of human, it's also the inner side like reproductive system that where responds when we are in sexual activity. When we say about sexual hormone, it includes sexual desire of the person. In the biology of sexual behavior, there are 5 factors present the birth: chromosomes, gonads, hormones, internal reproductive anatomy, genitalia. So when we say chromosomes is made by protein and single molecules of deoxyribonucleic acid, or as we all know as DNA. So in hormones is our chemical body messenger. So what hormones do? They travel in your bloodstream or tissues, organs. They work slowly but affect many different processes of your growth and development and metabolism, that how your body gets energy from what you eat. So when we say internal reproductive anatomy, this is the female part or the organs that were within the true pelvis. This include the vagina, uterus, cervix, or uterine tube, like what we call fallopian tube. Genitalia, the female or male reproductive organs. It includes the external or internal structures. So, how it can affect our sexual behavior? By touching and masturbating genitals in public or private, showing genitals to peers, standing or sitting too close to someone, trying to see peers or adults naked. So we can't deny the fact that most of us here have been encountered this kind of behavior.
Good day everyone, I'm Rey Caballero, and for this afternoon I'll be going to discuss the given topic, which is all about understanding the chemistry of lust, love, and attachment. But before I'm going to proceed, I'll explain first the differences between lust and love, because this is also part of my topic. So, what is love? For me, it is based on what your true feeling really is, or maybe your deep feeling to a certain person. So you get love, you are in love on that person because you want her to become part of your life for a lifetime. So something like that. While lust, so you are just looking on person's physical appearance. Maybe you get erected for the first time you saw them. So basically, lust can be considered as your sexual desire, nor not your true feelings. So let's proceed to my topic. And about my topic, it has 3 divisions. Types. As you can see in my screen, the lust, attraction, and attachment, and each of them have their own hormones. So for the last, testosterone, estrogen, and so on. But before I explain those hormones, I'll explain first these 3 types: the lust, attraction, and attachment. So for the lust, As what I have said earlier, it talks only about your sexual desires. So you get attracted to a person, it is because for your sexual desires. So while attraction, it's kind of the same with lust, but you get attracted to a certain person, it is because you find her beautiful or pretty. So like that. While attachment, from the word itself attach, for me it can be considered as love because it talks about long last relationship. And speaking of long last relationship, it only works when two people or couple truly love each other. And now, let's talk about their hormones. As you can see, lust composed with two hormones, a testosterone from a male and estrogen from a female. And in my understanding about these hormones, it is the reason why person drive their sexual desires. So that's the reason why a lot of people choose lust. While attraction composed with three hormones, the dopamine, norepinephrine, and serotonin. So the serotonin and norepinephrine, it will serve as your mental behavior, while dopamine also serve as your body movement. So what your norepinephrine and serotonin thinks, then your dopamine will react, and that's the reason why attraction occur. And the last one is attachment. It is composed with two hormones, the oxytocin and the vasopressin. So, vasopressin and oxytocin known as a peptides of love and fear. As what I have said, attachment can be considered as love. So, therefore, if you really love the person, there is also a fear on losing them. That's all.
I am here to report about the diversity of sexual behavior, sexual orientation, gender identity, and expression. Sexual orientation. It is an enduring pattern of romantic or sexual attraction to a person. Some people are attracted to people of a particular gender. Others are attracted to people of more than one gender. Some people are not attracted to anyone. People may identify more than one sexuality than another at different points in their lives. Sexual orientation, types of sexuality. Asexual, not sexually attracted to anyone. It does not necessarily mean that they are sexless. Asexual people sometimes do experience affectional or romantic attraction. Bisexual, a person feels attraction toward their own gender and other genders, or toward anyone regardless of their gender. So bisexual, two common misconceptions are that bisexual people are attracted to everyone and anyone, or they just haven't decided yet, often referred to as bi. Gay sometimes refers people who are attracted of the same sex, also called homosexual. Lesbian, a woman who is attracted to a woman. Lesbians sometimes also are alternately same-gender loving women or women loving women. Gay and lesbian is almost the same. Gay is men to men and lesbian are women to women. Pansexual, people who feel attraction toward people of all genders and sexes. Sometimes alternately omnisexual or polysexual. Questioning, one who may be unsure of reconsidering or chooses to hold off identifying their sexual identity. Queer, people of all sexualities under the LGBTQIA+ umbrella. It is an umbrella term which embraces a matrix of sexual preferences, gender expressions, and habits that are not of the heterosexual, heteronormative, or gender-binary majority. It is not a universally accepted term by all members of LGBTQ community, and it is often considered offensive when used by heterosexuals. Straight, attracted to people of the opposite sex. Also, sometimes generally used to refer to people whose sexualities are societally normative, alternately referred to as heterosexual. Gender identity and expression. The ways in which a person identifies or expresses their gender. One's gender is one's eternal sense of self and identity. One's gender expression is how we embody gender attributes, presentations, roles, and more. A person's gender identity is not restricted to being either a man or a woman. Some people do not identify with any gender, while others identify with multiple genders. It is also show a person expresses themselves to others and how they want the world to see them. Different gender identities. Androgyny, the mixing of masculine and feminine gender expressions, or the lack of gender identification. Sometimes used by who identify as genderless. Cisgender, a gender identity that society considered to match the biological sex assigned at birth. A term is used to call attention to the privilege of people who are not transgender. Crossdresser refers to occasionally wearing clothing of the opposite gender. It's preferable to transvestite, and neither may ever be used to describe a transsexual person. Genderqueer, third gender, gender fluid, as a gender identity or expression that is not the same as society's expectation. Identity and presentation that shifts between or shifts outside of society's expectation of gender. Intersex, general term used for a variety of genetic, hormonal, or anatomical condition in which a person is born with a reproductive or sexual anatomy that doesn't seem to fit the typical definitions of a female or a male. Status of having a physical, hormonal, or genetic features that are neither wholly female nor wholly male, or combination of female and male, or neither female nor male. Transgender, an umbrella term that encompasses all people who experience and identify with a different gender than that which their assigned sex at birth would suggest. Transgender, first coined to distinguish gender better with no desire for surgery or hormones. Transsexual, used to refer to individuals who have medically and legally changed their sex. Other labels used within this group are MTF, male to female or trans woman, and FTM, female to male or trans man. Two-spirit is an umbrella term that encompasses different sexualities and genders in indigenous Native American communities, having the spirit of both the female and female genders, male and female genders. That's all for today. Thank you.
Hello, I am Ishi Sanchez and I am going to discuss about the sexually transmitted diseases or the STDs. Sexually transmitted diseases, also known as sexually transmitted infections or STI, are very common. Millions of new infections occur every year in the United States. STDs are passed from one person to another through sexual activity, including vaginal, oral, and anal sex. There are many types of STDs, including this. So, what causes sexually transmitted diseases? STDs can be caused by bacteria, viruses, and parasites. Let's talk about who is most affected by sexually transmitted diseases. Most STDs can affect both men and women, but in many cases, the health problems they cause can be more severe for women. If a pregnant woman has an STD, it can cause serious health problems for the baby. Let's talk about the symptoms of sexually transmitted diseases. STDs don't always cause symptoms. or may only cause mild symptoms. So it is possible to have an infection and not to know it, but you can still pass it into others. If there are symptoms, they can include this. How sexually transmitted disease is diagnosed. If you are sexually active, you should talk to your healthcare provider about your risk about the STDs and whether you need to be tested. This is especially important since many STDs do not usually cause symptoms. What are the treatments for sexually transmitted diseases? Antibiotics can treat STDs caused by bacteria and parasites. There is no cure for STDs caused by viruses, but medicines can often help with the symptoms and lower your risk of spreading the infection. How can sexually transmitted diseases prevented? Using a condom correctly every time you have sex can help you avoid STDs. Condoms lessen the risk of infections for all STDs. So, if you don't want to have these STDs, it is better to not have sex to someone you don't know.
Good day to each and everyone. I am Rey Tumalon and I am going to discuss about the methods of contraception. Contraception is a method or device used to prevent pregnancy. Contraception is also defined as the intentional prevention of conception through the use of various devices, sexual practices, chemicals, drugs, or surgical procedures. There are two methods of contraception, which is the artificial method and the natural method. So first, we're going to tackle about the artificial contraception methods, which are the condom, oral contraceptive pill, intrauterine device or IUD, contraceptive implant, contraceptive injection, emergency contraception pill, contraceptive ring, diaphragm, and sterilization. First one is the condom. A condom is a sheath-shaped barrier device used during sexual intercourse to reduce the probability of pregnancy or sexually transmitted infection. Oral contraceptive pill. So the combined oral contraceptive pill, often referred to as the birth control pill or colloquially as the pill, is a type of a birth control that is designed to be taken orally by women. It includes a combination of an estrogen and a progestogen. Next one is the IUD or the intrauterine device. An IUD is a tiny device that is put into the female's uterus to prevent pregnancy. It's a long-term, reversible, and one of the most effective birth control methods out there. A contraceptive implant is a flexible plastic rod about the size of a matchstick that is placed under the skin of the upper arm. It releases a low, steady dose of a progestational hormone to thicken cervical mucus and thin the lining of the uterus or endometrium. A contraceptive injection is a shot that contains hormones, either a progestin alone or a progestin and an estrogen together, that stop your body from releasing eggs and thickens the mucus at the cervix. Emergency contraception pill is a way to prevent pregnancy after unprotected sex, often called the morning to after pill. Emergency contraceptive pills are pills that can be taken up to 120 hours or 5 days after having unprotected sex. A contraceptive ring is a clear and flexible ring of polyethylene vinyl acetate that, once inserted into the vagina, slowly releases the hormones progestin and estrogen into your body to stop the ovaries from releasing eggs. A diaphragm is a barrier method of birth control. It is moderately effective with a 1-year failure rate of around 12% with its typical use. It is placed over the cervix with spermicide before sex and left in place for at least 6 hours after sex. And the last one is sterilization or tubal ligation. A tubal ligation is a surgical procedure for female sterilization in which the fallopian tubes are permanently blocked or removed. This prevents the fertilization of eggs by sperm and thus the implantation of a fertilized egg. Tubal ligation is considered a permanent method of sterilization and birth control. Now we will proceed to natural contraception method. Natural birth control is a method of preventing pregnancy without the use of medications or physical devices. These concepts are based on awareness and observations about a woman's body and menstrual cycle. This includes the calendar rhythm method, basal body temperature method, mucus inspection method, symptothermal method, ovulation indicator testing kits, withdrawal method, lactational infertility, douching and urination, and abstinence. The rhythm method, also called the calendar rhythm method, is a form of natural family planning. To use this method, you will track your menstrual history to predict when you're going to ovulate. The basal body temperature method is a fertility awareness-based method, and it is a type of natural family planning. Your basal body temperature is your temperature when you're fully at rest. Ovulation may cause a slight increase in body temperature. Like for example, you'll be most fertile during the 2 to 3 days before your temperature rises. And by tracking your basal body temperature each day, you may be able to predict when you will going to ovulate. This may help you to determine when you're most likely to conceive. The mucus inspection method is also called the Billings ovulation method, and the cervical mucus method is based on careful observation of mucus patterns during your menstrual cycle. This one, before ovulation, cervical secretions change. So by creating an environment that helps sperm travel through the cervix, uterus, and fallopian tubes to the egg. A symptothermal method is a fertility awareness method that uses to predict when a woman might be fertile. This method is just like the basal body temperature that uses body temperature and other signs and symptoms of ovulation. Next, we have the ovulation indicator testing kits. The ovulation testing kits are similar to urine pregnancy tests. You will urinate on the test strips every morning. Starting a few days before you think you will ovulate, the test strips detect luteinizing hormone and it surges right before ovulation. The withdrawal method of contraception is the practice of withdrawing the penis from the vagina, and the goal of the withdrawal method, also called pulling out, is to prevent sperm from entering the vagina. The lactational amenorrhea method. This method was created to allow women to safely rely on breastfeeding as a family planning method. Based on scientific research, this method uses 3 measures of a woman's fertility. Number 1 is the return of her menstrual period. 2, her patterns of breastfeeding. And the last is the time of postpartum. Then we have the douching and urination. This method is washing or cleaning out the inside of the vagina with water or other mixtures of fluids. The mixtures usually come in a bottle or bag. The procedure for this is the female will squirt the douche upward through a tube or nozzle into their vagina. The last method is abstinence. Abstinence is simply not having sexual intercourse. If you're abstinent, it means you've decided not to have sex. And abstinence prevents pregnancy by not giving the opportunity for semen to enter the vagina. Sperm can't fertilize an egg if you don't have intercourse.
Good day. Let's discuss John Lee's style of love. Basically, this day extension on that discussion. Long story short, according to him, these are different style of love, characteristic or characterized by behavior or attitude. For his own theory, the first is what we call eros. So the eros is more like sexual and emotional love. Okay, it's important and partners to be able to make their way through eros. This is followed what we call the agape, and agape is type of love is altruistic and selfless love. It may sound like having an unconditional love towards your relationship. And after that, we have what we call strougi or strogi. And strogi is love-related friendship based on non-sexual affection. And we all have what we call ludus. And when we say ludus, it's just a game that they think, just nothing serious, or they don't feel jealousy. And however, you don't you don't have to be obsessive and possessive because that would be mania. Wherein mania is easily get jealous and experiencing of love is out of control. And other hand, that we just what we call pragma, practical lovers, which their commitment is not based on attraction, but rather it's based what an appropriate. And if you have pragma, you are a type of lovers that planning to getting married and have children and having plan for their future. Thank you.